I like talking to people. I like hearing people's, I want their questions. I like hearing their questions. I like hearing their solutions. I try to get everybody, when they come up with their problem, so how would you do it? If it makes sense and it fits with what we're doing, we'll review it. But let me tell you, one thing, every agency in the federal government, it seems like, offers grants. And you've got to be very methodical in how you go through it, because it's not like, it just does one thing. There's always a string attached. The federal government doesn't say, oh gosh, Governor Scott, here's some money, do whatever you want with it. Okay, say, here's what you have to do, here's how you have to do it, here's the measurement, and gosh, when we decide to quit, we want you to keep doing it. So you got to be very cautious how you do it. I've been in healthcare all my life. Here's how things work in healthcare. You want to have as much choice as possible. Competition generally reduces the cost of things and improves the quality. So I want as much competition. I know that healthcare costs would come down if everybody was healthier. So the things that help people, don't smoke, eat right, exercise, things like that, I believe in. The more personal accountability there is, I believe in. So those are the things that I know work, because that's worked. I've been in healthcare my whole career, and those are the things that work. So that I'm going to promote, because that's what we're doing with Medicaid. But here, let me give you an example on the healthcare exchange. If a healthcare exchange was good, wouldn't you think the private sector would have done it? Actually, what actually happens in these healthcare exchanges, then the government starts deciding what sort of healthcare can be sold. What I want to do is, what you need. It's not right for me to be telling you what you need. And that's the problem I have with the exchanges. All it's going to do is raise the cost of healthcare in this country. It's not good for you. It's not good for you. It's not good for you as a patient. It's not good for you as a taxpayer. It's not good for you as a business person. That raises your cost and makes you lose jobs. First off, as you know, we have a lawsuit now because I believe, and the Attorney General Pam Bondi believes, that the Obamacare, the Affordable Health Care Act, is unconstitutional. I believe it's going to be held unconstitutional.